health news, when it comes to cancer prevention, it's the little things that count. Small lifestyle changes can make a big difference. 1/3 of most common cancers are preventable with proper nutrition, regular physical activity, and a healthy lifestyle. Joining me with more information is Dr. John Humphrey and Cancer Center urologist Stephanie Patterson. Good morning. Thank you so much for being here with us.
Thank you for having us.
Absolutely, of course. Many people want to know what they can actually do out there to reduce their risk of getting cancer.
Yeah, and one of the most important factors that we often talk about is tobacco use. If patients don't smoke, they can go a long way towards reducing their risk for many types of cancer. We also really encourage people to participate in cancer screenings with their physicians in order to detect it early and prevent it. And then the other two factors that are really important, as you said, are engaging in physical activity and maintaining a healthy diet.
Yeah, absolutely. You know, a lot of people say, you know, my grandma had cancer, my uncle had cancer, whatever, but can cancer really be prevented? Is it really all hereditary?
You know, there's unfortunately no way to guarantee that you don't develop cancer in your lifetime. So what we have to focus on are modifiable factors within our own lives to reduce that risk. If you can achieve and maintain a healthy weight throughout your life, it's going to go a long way. And with that is the physical activity and the nutrition.
And Stephanie, I think that we get bombarded with all sorts of different ways that we could attack our nutrition and upgrade the way that we eat, but how do we really know what's right and best for us?
Right. So what we discuss with patients are a combination of the American Cancer Society and the American Institute for Cancer Research guidelines, which includes increasing your fruits and vegetables, including whole grains, reducing or eliminating alcohol, as well as meats that are very high in fat, high in nitrates, and trying to include a healthier diet overall.
Yeah,
so,
and when you were here over Christmas, you talked about eating the rainbow, basically.
Right.
Kind of keep that in mind when we're filling up our plate, right?
Yeah. So when we are looking at increasing our fruits and vegetables to 5 to 9 a day, we look at the deeper, darker colors, which is what I talked about over at Christmas. So yeah, I definitely included that, as well as some food that I brought today here with me in just a way to do that. So today we have an energy bite, and these are made up of some whole grains. We have oats and we have flax meal. Flax meal is the ground up flax seed, and that would be something that's very high in omega-3 fatty acids as well as fiber. And then we include some good protein sources, and it could be peanut butter, it could be an almond butter, it could be any type of cashew butter. And then some unsweetened coconut, maybe some honey or an agave nectar, and then some fruit. Sometimes we'll put in mini carob chips or dark chocolate, something like that. But these are nice breakfast, a nice snack for during the day for kids, for adults. I have some regularly in my fridge at home just to grab. And it's a good source of fiber as well as protein to kind of keep you going.
And for something for kids to make too, there's no stove or any type of cooking involved. Or for people that can burn water, this is kind of a good snack for them. And I said this is very fitting. Yes, this is great when we're coming to talk about cancer prevention and all that. But with a day like today, when many people are struggling with the time change, I think Energy Bites is something that everybody's ears kind of perk up, saying I need those.
Absolutely.
So all these ingredients is something you got here locally?
Yes, absolutely. And most of the time, I think most people would see these ingredients in the grocery store, but something like the flax meal, you can either buy the whole flax seeds and grind them in your coffee grinder at home, or you can buy the flax meal, usually down the baking aisle at the grocery store, and that would be something that you would just get next to the other whole grain flours and things like that. So,
and this is just a great example of what's coming up at an upcoming doctor dialogue too. If you guys want to go ahead and touch on that information, we'll put the details up on the screen for those at home that want to kind of read along.
Sure. So it's Eat Well, Live Well, Be Well, and it's a doctor dialogue on March 23rd on Wednesday in the evening. It's free and open to the public. and we will have 3 different physicians, Dr. Humphrey, Dr. Brady, and then talking about genetics. Myself and another oncology dietitian will be talking about the benefits of good nutrition, as well as we have some of our executive chefs that are actually preparing food for us, and we'll share with the group, and it'll be a fun event down at the downtown market.
So you get to eat, everybody.
Yes.
And learn a lot along the way. All right, thank you so much for stopping by.
Yeah.
Can't wait to give one of those a try. So once again, if you have been diagnosed with cancer as well, and you really like a second opinion or consultation, don't hesitate. Please call 855-SH-CANCER. Thanks.